Good afternoon, everyone. I'm wearing a mask because I'm here with Michael Rayum from Information Services. And thank you, Michael, for getting us ready technologically for this. I think we'll just kind of go slow for about a minute and wait for folks to transition between meetings. And while we're doing that pause, I want to let folks know that we did make a mistake in Cooley News Now with the email address to send your booster information. And we will get that corrected and get that in Tuesday's CNN. So you can be on the lookout for that. I will read it though. It's PHSOHS COVID-19 at partners.org. That is the correct email address. But again, that will be in Tuesday's CNN. So it is just now about 4, maybe about a minute after 4. And we have 90 folks, 91, the numbers keep going up. So let's just wait a minute. Let everybody settle in. So people will continue to trickle in. It is about a minute after. So out of fairness to everybody else's time, we should probably get started. This is the CEO Town Hall with Dr. Lynnette Watkins. I'm Jeff Harness, and wish we could see everybody in person, but we can't yet. That day is coming soon, I hope. And with that, let me explain just a little bit about the format. We are going to hear comments from Dr. Watkins, and then we will have some time for questions and answers. I received several questions already from folks. And if you have any questions, you're welcome to put those in chat or the Q&A function, and we will go from there. So with that, Dr. Watkins, let me turn it over to you.
Thank you, Jeff, and good afternoon, everyone. And it is a pleasure to be here with you again for another town hall meeting. And as you're aware, we want to make sure that we as a leadership team and I as your president and CEO are as accessible as possible to answer your questions, particularly during this very challenging time. We realize there's a lot of information out there, still a lot of uncertainty, and we're in the midst of another surge, and that we are all tired and anxious, and it feels like this pandemic continues to come and go, and that there may not be any end in sight. However, please know that there is a lot of work that and also is occurring behind the scenes to actively take care of and support our patients, as well as take care and support you. You are incredibly important, and care for the caregivers is incredibly important. We've had some very good sessions and forums on everything from employee assistance to patient experience. Our Joy and Gratitude Committee is very much active in at work to help support you, because what you do is incredibly important. And I really appreciate you taking time to be here, and hopefully this session will be helpful in answering some of the questions that you have on your mind.
Thank you, Dr. Watkins. And with that, can you say a little bit about some of the ways that Cooley Dickinson and Mass General Brigham are supporting employees, and get into a little bit more detail about that?
Absolutely. So Mass General Brigham, and we're very fortunate to have this very strong partnership, is actively working with us on a whole host of initiatives, particularly during this pandemic. There is a system-wide or enterprise-wide facility group called Enterprise Capacity Management that Tony Sibeli, our Chief Administrative Officer, and I sit on, and we work together on surge and scenario planning. It is through that group that we work together to get assistance for redeployment needs, as well as assistance when we have questions and issues regarding protocols around masks. There is an ambulatory focus that helps assist us with recommendations for our clinics. This is also the group that helps us identify areas where we can get needed products such as blood, which is in short supply, particularly right now, since there is not a whole lot of donation efforts that are out there. This group really is the group that helps us to plan, to coordinate, and also to think through potential issues should we continue to have surges in our numbers of COVID patients, whether it is working through emergency credentialing and policies and procedures, infection control and prevention, and a lot of the modeling that you hear about here in the region and across the country is done right here at MGB, supplies and equipment or other strategies. That's why it's incredibly important, and we are incredibly fortunate to be a part of the Mass General Brigham system. Additionally, this group also works with other areas throughout Mass General Brigham in support of our caregivers. It works with our human resources department and enterprise in determining where we have vacancies in individuals. This is also where the tracking of those who are exposed and or positive occurs. This is also where we get guidance regarding testing and has been working with us in securing tests that are sent to our facilities, particularly the rapid antigen tests, and also has a dashboard to identify across the enterprise where there is testing available. So lots and lots of support in addition to other things that have been there pre-pandemic, such as employee assistance to help with any sort of additional support, particularly during these challenging times.
You mentioned the blood shortage, and that really caught my attention, and the way that Cooley employees have responded to that. Would you like to make a few comments about the blood shortage and how we're handling that?
Absolutely. So because of this time of the year anyway, but also because of the pandemic, typically there are fewer donations, but that does not mean that we don't need blood for surgical procedures or for patients that routinely need blood transfusions or oncologic patients. And when we say blood, we really mean blood products. That also includes packed red blood cells as well as platelets. Well, the supply of blood and blood products really across the country because of the pandemic and the time of the year has gotten exceedingly low. And the American Red Cross is not able to provide us as much blood and blood product as what they would like to or what they're used to. Additionally, they've also been hit hard by COVID exposures and COVID illnesses as well. So they simply don't have the staff. So we've been able to partner with Mass General Hospital and the Brigham to secure Bloodmobile. And we actually, through the leadership of our lab team, particularly Kathy Reed and Dr. Christakos, to secure a Bloodmobile from the Brigham, secure staffing, and February 3rd and 4th, we had up to 90 slots available to give blood and blood products. I believe just about all of those slots were filled primarily with staff and employee colleagues. So a wonderful, wonderful response. And about a third of those products remain right here at Cooley, potentially more. So this is a huge, huge opportunity to give blood and to replenish our supply.
And I did just get a message that those dates are full. However, there is a waiting list. So anybody who has not signed up but who is interested, you can join the waiting list. And if there's a cancellation, you could donate then. So Dr. Watkins, you've been here now for, I think, about 3.5 months, although it must seem longer to join the organization as a CEO during a pandemic is quite extraordinary. But at this point, can you talk a little bit about what your top priorities are, maybe your top 3 or so?
Well, it has really been a pleasure, and the time has really flown by. In the midst of such challenging times, I've really had the opportunity to see the very best of who we are and what we can be at Cooley. Focus and priority number 1, of course, has to be the service to our patients in our community. We have to focus on that. It's why we're here. It's what we do. But very closely behind is my focus on all of you, our workforce. We have to have a strong, resilient, vibrant workforce in order to be able to continue to commit to provide the services that we currently provide, as well as those that we really need to commit to in the future. Our population is growing older, and as we all age, we need more care. And particularly with this pandemic and multiple surges, as you all are seeing and experiencing now, patients are coming in sicker. They're staying longer. They have more complex issues, which ultimately means more care and more intensity of care. We're also a workforce that is tired. We've had issues with COVID, whether it's been exposure or illness or the socioeconomic fallouts of COVID-19, among other things. So burnout and resilience is real, whether it's a colleague that is in the nursing realm or food and nutrition services, or one of our physicians or providers in the clinic. It is affecting all of us. So those are the two things that are really top of mind. Of course, making sure that we are providing the care that we need to provide and are committed to and should be committed to our patients, as well as having the workforce for now and into the future.
Thanks. So I received several questions from staff during the week in preparation for today. And one of the questions I got has to do with the National Guard and how we're using them and what to expect in the next week or two.
Absolutely. So the National Guard was activated by Governor Baker, and approximately, I believe, 500 National Guard has been deployed, I believe 300 and 200. And those were distributed throughout the hospitals across the Commonwealth for primarily non-clinical roles. So particularly sitters, EVS, food and nutrition services, safety and security. We've had two of our colleagues here at Cooley Dickinson, and they've been invaluable. They've worked with us with our security team. They've also worked with us as sitters, and they've been absolutely wonderful. And we want to make sure that we continue to provide them a great experience because they've been such a great support. There's been some discussion as to whether or not there would be assistance on the clinical end, and really that is something that FEMA and the federal government would activate at this point in time. But our National Guard colleagues are primarily deployed for non-clinical roles.
So before I read the next question, let me just remind everybody, if you have a question, you can type it into the Q&A function. So the next question is focused on employees, and the staff member writes, for employee retention, are we looking at performance-based raises? And then the second part of the question, are we looking at selling back vacation time, which is something that some of the other Mass General Brigham hospitals offer?
So at this point in time, we do not have plans regarding performance-based raises. And I know we have in the past considered, and I believe done, sellbacks of ETO. And that the latter is something that we are looking at, although we have not decided at this point to go ahead and proceed. And we are working with our MGB partners on what that would look like. There are lots of things that we are doing in addition to shift bonuses, as well as additional options for covering of shifts, particularly evening and overnight shifts. Of course, as you all are aware, we have to make sure that we get the support and are in alignment with our union partners, because particularly for those roles that are part of the bargaining unit, we need to make sure that we are aligned with our union partners and that they are aware and supportive. During this surge, we realized that everybody is doing more. And while we do not have infinite resources, we try and utilize what we do have as much as possible. Additionally, we also have a Joy and Gratitude Committee, and members of our community are also very, very supportive of what we're doing as well. And I know Diane Duquette and Megan Murphy and the team have really worked hard to engage outside groups such as our chambers of commerce. Our board of trustees even are very interested and have been working with the Joy and Gratitude Committee to support and provide events, food, etc. to our staff. Our PFAC committee actually just had a wonderful cookie drive and as a thank you and support. So we are looking at a whole host of things and working very hard to really make as bearable as possible the experience, considering that this is a very challenging time.
So while you were talking, a question came in asking what specifically are the bonuses that are being offered, and looking for global communication to nursing with specifics.
So that is something that I would actually defer to our HR leaders as well as our nursing leaders. And those are often dependent on the area as well as the time of day. So Angela Belmont and Deb Grant and team, along with Annie Bouffalette, can provide additional details on those. One must remember that we have different levels of vacancy in different areas, and we have to respond to those. And that's not just our nursing areas, although that's incredibly important. We do have other technical areas that, that we have to also address in between our staffing with agency, as well as with shift bonuses. There are a multitude of things that we are doing at the local department and unit level to fill. We also have policies around pay and callback, and most of all, we have to make sure that those are aligned with what's in the contract and what we have agreed to with our union partners.
The next couple of questions are a little bit COVID related.
Mm-hmm.
The first one is very much COVID related. And the staff member writes, some local schools are now having students wear KN95 masks. Are we going to switch to KN95s instead of surgical masks?
So that is a very good question, and actually one that Mass General Brigham is discussing even as we speak, because we are not the only area where that's being considered and enacted. Actually, there was just an enterprise-wide call today where this was discussed, and some of the towns in Boston and certain areas were considering this as well. Here's the issue. Although masks, particularly N95s and KN95s, are more plentiful than they were before, it's not infinite. And particularly for some types of masks, they're not as plentiful as others. So what you will most likely be hearing into the future, and Cooley, we've already been proactive and done this, is that there will be an expectation for us to fit test for multiple types of N95s. There was some discussion as far as whether or not the CDC was going to recommend that N95s or KN95s be used during all activities, indoor, outdoor, etc. That has not come to pass. But at this point in time, right now, the MGB guidance is to continue to wear the surgical mask, that they are finishing up the due diligence regarding whether or not to change to a KN95 or stick with the surgical mask, except in those areas where we know that there are COVID positive patients, in which case the N95s, whether it's a 3M 1860 or 1860 small, or the halyards, which are the ones that we use here, would be the ones that are most appropriate. So please stay tuned. There is not an answer, but at this point in time, we will continue with the surgical masks unless there is a COVID positive patient that is a known positive, and then switch to one of the N95s.
The next question is about negative pressure. Can we have more of our labor rooms, so this is childbirth, or perhaps all of them changed to negative pressure?
So this is a very good question, and our facilities colleagues can do quite a few things and can potentially change our rooms to negative pressure. However, there's always a cost benefit to doing that. Whenever there is a change in our with our pressurization and with our HVAC systems, that is something that is potentially pretty difficult and does change our life safety profile. So it is not something that can be turned on just like that. It's something that our facilities folks, in conjunction with others, really need to do their due diligence in order to make that happen. And there has to be additional assessment of that as well. We do have quite a few areas that are negative pressure, and as part of our surge planning, we have identified more areas that potentially could be negative pressure rooms. So depending on the number of patients, the number of potential COVID positive and enhanced patients, and where we would put them, also determines where we would potentially need to have more negative pressure areas. So there's a lot that goes into that. Realizing that there are concerns with, particularly with laboring patients. Often if there is a question or a concern, the safest bet is to utilize the enhanced precautions protocol and don and doff appropriately.
Our next question is, do remote employees require COVID booster shots also?
It is my understanding, and we can certainly get clarification, that all Mass General and Brigham employees require booster shots. And I would just say this, I know there's been a lot of question about this and about vaccinations in and of themselves. We are seeing a once in a lifetime pandemic, and vaccines are really a modern miracle. Realizing that there are still respectfully a lot of questions, concerns, particularly religious concerns out there. Vaccines are here really to take care of and prevent severe disease, hospitalization, and death. We want to make sure that we have vaccinations in order to keep patients safe and also keep our caregivers safe. And there is excellent research out there, including from our partners at Mass General Brigham, that show after that second vaccination, mRNA or even single dose J&J, that the protection does wane a bit after greater than 25 weeks, but with the booster, it goes right back up again. So it is really critically important that no matter where you are, we cannot emphasize strongly enough that absolutely get the booster. Do it for you, do it for your family, and do it for your community.
Let me take that opportunity to remind folks that there will be a booster clinic here. I believe it's 7 to 9. The information is in Cooley News now, but I believe it's Tuesday morning. And people can walk in, or they can use COVID Pass to sign up for that. And let me remind everybody to add your questions to the Q&A. And while we're waiting for a few more questions to come in, I have one of my own, and that is, we have made a remarkable, I guess, kind of progress, I will say, in the last year towards financial stability and health. And wouldn't you know it, COVID comes along again with yet another surge. It makes our jobs even more challenging in that regard. Can you talk a little bit about how we're handling finances during the COVID surge, how it's impacting us, and what our plans are to mitigate and recover?
Sure. Well, you know, COVID-19 has really tested every single aspect of the healthcare industry and how we deliver care. And of course, has been a huge financial stress as well as personal stress, operational stress, and provided other stressors. And unfortunately, with this surge, it has caused a negative impact to our financial health. Now, that being said, we have quite a few plans in place and underway to mitigate the challenges that we have and the negative impact on our finances. But basically, it comes down to three areas. One is loss of volume, and that is because in large part of the mandated reductions in non-urgent, non-essential, or what in the lay press is called elective cases, although you and I know that there aren't a whole lot of truly elective cases. But that being said, we are and have been proactively following the state's guidance and MGB's guidance in pausing these cases. Initially, that required inpatient stay, including 24-hour observation, but even more so under MGB's guidance in reducing our overall capacity now by 50% of any procedural cases. This does not include any urgent or emergent cases and is subject to clinical judgment. So if a doc or provider says this case needs to go, it goes, and clinical judgment supersedes everything else. But because of that, there is a significant financial impact. Now, you and I have both been through a couple of surges, and part of what we're experiencing now is because of delays of care from previous surges. So we anticipate that there is going to be that volume recapture probably in the next couple of months. But right now, because of the decreased volume of procedures right now, that has really taken a negative impact. The second is the cost of staffing. And as you know, this is a time when we've all been affected by COVID. We've either been exposed or had an infection or have a family member that's been infected. And also, we have a lot of colleagues that because of burnout, turnover, and other things are just deciding this work is not for me. So 1 out of every 5 healthcare workers is resigning and leaving to do something else. So because of that, we've had double-digit turnover and vacancy rates, and this is carefully being tracked, that have been 12% or higher. And so because of that, and particularly in areas where this has impacted us so that potentially our vacancies cause us to be below staffing, core staffing and staffing to provide services, we have had to go to outside vendors, to agencies. We've had to offer shift bonuses. We've had to provide overtime pay, which have caused a significant amount of cost, 6-figure cost each month, in order to be able to staff to the levels that we need to staff, particularly as we continue to surge and see more patients. This is on the inpatient side as well as on the outpatient side. So it impacts the entire continuum. And then finally, to a lesser extent, but still having an impact, is the amount that we're paying in benefits, because colleagues are utilizing their healthcare benefits because they've been ill or they've had family members that have been ill. So volume decrease, staffing challenges, and benefits costs, all three have caused us to be in a financial position that is not where we want to be. That being said, the senior team, along with several of you, have put together a very robust mitigation plan. Some of this is coming from different areas. Some of it is actually driven by some decisions that the government has made regarding the Medicare sequestration, which was a holdback, which we have identified is going to be less than what we initially anticipated. Additionally, there are other both efficiency opportunities, as well as growth opportunities and recruitment opportunities that the team is leading and exercising as well. I think a lot of you have heard that we can't cut our way to the top. We have to grow our way to the top, which means identifying areas where we can grow through recruitment or expansion of services in order to be able to get back to the financial stability that we really want to have.
So your comments about our financial state prompted one question, which is, has working remote helped the financial state of Cooley?
You know, that's a very good question. I think that it depends on the area. There are some positions that have to be in person. And a lot of the vacancies that we have had where we've had to spend additional funds in order to staff have been on site. And the big focus has been for addressing those vacancies that are closest to the patient. So I think that, you know, the ability to provide remote work, I think it's important to have that, but there are going to be some instances where it's not feasible to have a remote work option. And we've identified that particularly with clinical areas, patient-facing positions, those are the ones that are in the most short supply, where we end up spending a great deal of resources making sure that we have those individuals available.
The next question is also about staffing. It's a little bit different though. And the question is, can you speak to the redeployment locally and what kind of redeployment support from Mass General Brigham we're getting?
Absolutely. So this surge has identified, and previous surges have been focused on the impact of the virus on patients and patient flow and operations. This current surge has really shown us the vulnerability of the workforce. And as we have been asked to pause and redeploy staff, it was for preservation of staffed beds. As the continued reduction and pause in cases and procedures moves on, it has been the additional redeployment of staff throughout the hospital. So there's been a lot of focus, particularly on our procedural areas and our procedural teams to be redeployed, whether it's to the overflow area and endoscopy next to the ED, or up on the floors, the med-surg floors, or even to some of our more critical areas to the ICU. As many of you know, unfortunately, we did have a situation where we had to close to admissions our West 5 floor because of an exposure, and some of our psych nurses and teams were redeployed to the rest of the hospital. So we have worked hard to utilize as many individuals as possible from as many areas as possible to redeploy to the different parts of the hospital. What was shared this morning in our leadership forum, additionally, was that we have several individuals that are working in primarily non-patient facing, non-clinical areas that have volunteered to help out in clinical areas, performing often non-clinical duties, but serving as additional support and helping hands. That greatly helps our clinical colleagues and helps to move patients along, as well as improve the overall experience of the staff and the patient, which is incredibly important. So everybody has been pitching in.
So the next question, we're actually going to go back to the topic of finances just for a second. And the question is there talk about the state or federal government, as in the past, being willing to step in and assist financially?
So, you know, that is a great question. And the American Rescue Plan Act was passed not so long ago. And Currently, $250 million has been approved by the state for dissemination. We're not sure how that is going to be disseminated. But one note, and this does, really impact what we do at Cooley as well. The chair of the Joint Committee of Healthcare Financing, Representative John Lawn, was at our facility at Cooley on Monday morning. And thank you, Jeff Harness, for arranging this, along with our executive director of the Massachusetts Hospital and Healthcare Association. They wanted to see, Representative Lawn, along with our own representative, Lindsay Sabadosa, wanted to see firsthand how this surge was impacting hospitals and healthcare facilities. So Sarah McEwen and her team were very gracious to tour them so that they could see firsthand the number of patients, the patients that were waiting in the hallways, in the waiting area, in the overflow area in endoscopy, those that really needed care in the psychiatric area, holding area as well. Those are the individuals, particularly Representative Lawn, that write a lot of the legislation that disseminates those dollars. We want that to happen. We want those dollars disseminated because there's an additional $250 million that will have to be dispersed as well. So there's a lot of discussion regarding the funds from the American Rescue Plan Act, of which $500 million total. It should be coming to hospitals and healthcare facilities, for the first $250 million coming shortly.
Okay, we're going to switch topics, and I'm going to warn you ahead of time. The next question is very long.
Okay.
Okay. The question is, I'm glad our Cooley Dickinson nurses are able to celebrate MLK Day and other holidays, such as President's Day and Columbus Day, which other employees are not given as holidays. Nurses are able to have these holidays due to their membership in their union. How do you understand and reconcile the principle of equal benefits operating in our workforce when the fact of union and non-union workers creates unequal benefits?
So that is a great question. And I know that Cooley Dickinson has a very long history with our union and union partners. And I say that on purpose. We are here to partner together with our unions in order to provide care. That being said, we know that no situation is perfect. We know that Mass General Brigham has been working very hard to identify holidays that are, in addition to the ones that historically the vast majority of the country has observed, also ones that represent the diverse, equitable, and inclusive population that we have here. We realize that there are historical agreements in contracts and contracting that codify some of these holidays. And what I can say to you is that we continually work and negotiate those holidays and understand why one is more is observed in a contract versus the other. I do not have a great answer for this. However, it's something that has to continue to be discussed and evolve.
The next two questions, we're going back to COVID for a minute. Wondering if you can share any insight about this particular strain. I assume they're referring to Omicron and its duration.
So Omicron, and it's interesting because when we first heard about it in South Africa, it was one of those variants of concern. And then we were very much focused on the Delta variant. And then as quickly as we heard about it, it was here. And it is definitely more infectious. It has multiple mutations. But what we're also hearing is that while it is more infectious, our models and some of what we're hearing through Mass General Brigham and others through studies in London and South Africa and in New York City is that it peaks and then the decline is fairly swift. We still have a couple of more weeks easily of this virus and potentially its surge and surge potential. However, and we heard that this just today on our calls at Mass General Brigham, that they're starting to see a stabilization to a slight decline in some of the early indicators of the virus. One of which, although it may be a bit unpleasant to talk about, is the virus in wastewater. Usually that is one area that we start to see trends if the virus is increasing or decreasing. And a lot of our researchers are starting to see that the viral loads in wastewater are actually stabilizing to slowly decreasing, which is a small but positive glimmer of hope.
The next question is again about vaccines and boosters. Will employees be able to receive the new vaccine coming out in March that will fight against the Omicron virus, or is it mandatory everyone gets the current booster?
At this point, it is mandatory to get the current booster. I do not know about the availability of future vaccinations. And I know there is also other potentially very exciting medications out there for those who are infected and ill. But at this point in time, Mass General Brigham is saying that it is mandatory for those who have, I believe, have gotten their vaccinations before August of 2021 to get the booster before March, and then after that to get the booster before, I believe it's June.
So I believe we have addressed all of the questions that came in, which is great timing because we're almost out of time. If I did miss any, if I skipped over any, let me know and we'll get a response. Actually, someone just did type one more in. Hang on 1 minute. Bay State is offering monoclonal antibody infusion. Is this something that Cooley is looking to participate in?
So that's a great question. What we have found, though, is that monoclonal infusion is not effective for Omicron, and not like it was with the Alpha and the Delta variant. There are infusion centers in other parts of the Mass General Brigham enterprise, but that is something, and actually Mass General Brigham has an ambulatory component of the enterprise capacity management team that is really overseeing where those infusions and infusion centers occur. But one reason why that has been pulled back to a great extent is that monoclonal infusion has been shown not to be effective for this variant that we're dealing with now, which is primarily Omicron.
So Dr. Watkins, this is your second town hall. I'm sure we'll do more.
Absolutely.
And at the end of your first one, I put a question out there just kind of for fun. And you mentioned you were looking forward to your husband and your dog coming up and joining you. So I know they're here now.
They're here.
Yeah, what has been an adventure in Western Mass that you guys, your family has enjoyed in your brief time here?
Oh, we have really loved exploring the area. So we have found and closed on a home. So we are now officially residents here. And we love going and just sightseeing. One of my goals for 2022 is to learn how to snowshoe. So we've been learning how to do that. It's been wonderful hiking and going to Look Park and going on the Nortec Trail, as well as finding wonderful restaurants and quaint places to go. I've loved the art scene here, which is terrific. It's just been a wonderful place to be and continue to enjoy exploring it. And my puppy, who's now almost 19 months, is really enjoying the snow. So, and I hear she's going to have a big chance to do that later on this weekend and into Monday. So.
Very good. Well, thank you. And I want to thank everybody for participating and your questions. And a big thank you to you, Michael, from Information Systems for all that you do to make this happen. We will end now. So have a good afternoon, everyone.